Okay, I just wanted to go over with you details of the adrenal gland. Adrenal gland is pretty important for homeostasis within our body and for the fight or flight. When you talk about the adrenal gland, you know the word adrenaline, and you feel what adrenaline feels like when it goes through your body. If you've ever been scared or excited or anxious, that's the feeling of adrenaline going through your body. So what does that actually mean? Well, adrenaline is what we refer to as the epinephrine and the norepinephrine that are going through our body, and that actually comes through from the adrenal medulla, which is the center portion. We call those hormones catecholamines. They arise from chromaffin cells, and they are specifically epinephrine and norepinephrine. So I want you to remember that within the medulla of the adrenal glands, that's where what we call adrenaline comes from, and that's epinephrine and norepinephrine. And what does it cause in us? We talked about how epinephrine and norepinephrine from the adrenal medulla causes increase in heart rate, increase in the cardiac output, the increase in, or the dilation of the bronchioles so that we can breathe better, so we can run. Also, will decrease the GI system a little bit, so we can either fight or flight, or we can rest and digest. And there are two aspects of our autonomic nervous system that cause this. So the other thing that is really interesting that I do want you to remember too is that when this medulla is activated in a fight or flight, those symptoms that you get from adrenaline going through your system are the same, or essentially the same, from as fear or excitement, anticipation or excitement, or anxiety. So I want you to remember that when you're taking the next time you take a test. Think of it as not as test anxiety, but test anticipation, because physiologically those are the same things. Now, in the cortex of the adrenal gland, we have a lot of different things going on. Toward the medulla, we get androgens. So this is the zona reticularis, and the androgens that we get from that part of the cortex are like testosterone. Okay. We also get mineralocorticoids from the cortex, and that comes from the outer layer of the cortex, which is the zona glomerulosa, and mineralocorticoids are like aldosterone. Now, what do mineralocorticoids do? Well, they regulate minerals within our body, and specifically aldosterone regulates sodium retention from the kidneys back into the bloodstream. And with sodium goes water. So aldosterone is also an antidiuretic hormone. Within the middle of that cortex is the zona reticularis, and it's within that, is the zona fasciculata. And within that is where we get our glucocorticoids, or cortisol. Within the cortex, we get cortisol. And those are the steroids that we refer to when we're talking about anti-inflammatory, immunosuppressive, shock doses of steroids, prednisone, prednisolone. Those are the medications that we use. But cortisol is basically a stress hormone. So this is the kind of detailed understanding of the adrenal gland. I want to make sure that I brought this to your attention because it's really important as we talk about the endocrine system.